going to be on antenatal care at pregnancy clinics. Okay, so before you even want to get pregnant, you have to make sure about certain conditions that you may have already or you have experienced in your previous pregnancies. For example, if you are a known diabetic or you tend to have diabetes in your pregnancies, you should be taking your anti-hyperglycemics, or try considering it to converting this regime of your anti-hyperglycemics to insulin for better outcomes and better glycemic control. The other condition that you should be looking out for are certain cardiac diseases. For example, if you have valvular replacements or any certain disease that you know that you have had in previous pregnancy, or you currently are having one, any sort of surgery on cardiac valve or any surgery involving your cardiovascular system should be taken into account. And for the treatment of certain condition, usually drugs like blood thinners, anticoagulants are given. So if you are on that medication, you also have to look out if you want to get pregnant. Then comes the genetic diseases. For example, there's a genetic condition, phenylketonuria. So if you know and you have been diagnosed with this condition, so you have to look out for phenylalanine in your diet, and there are certain fruits and certain diet products in which you can completely avoid the phenylalanine as much as possible to have a smooth and good healthy pregnancy. Now, for people who are on drug therapy, for example, epileptics who are taking anti-epileptic drugs, which tend to cause congenital anomalies. For example, the baby may be born with certain neural tube defects due to folic acid deficiencies that are caused by these anti-epileptic drugs, or anticoagulants that could be the cause of, for example, warfarin. Okay, that is also one of the major cause of causing congenital anomalies. So in case of anticoagulants, warfarin, you have to shift to a safer drug, which is heparin. Okay, and in anti-epileptic drugs, a dosage of folic acid supplements should be added to the daily supplements. Like, this is the basics of having a health chart or your own personal health. Like, you have to counteract all these things. You have to look for other different medications that are less harmful or not causing congenital anomalies in the baby, and will help you through the pregnancy to have a better outcome. For example, if you are diabetic and you have a poor glycemic control, that may cause congenital anomalies not only in the baby, but it will cause an increased size of the baby, which will be difficult to deliver through normal delivery, which is called NVD, or normal vaginal delivery. And then doctors may have to advise you a C-section in that case. So that's all for today, and thank you very much. We will continue on this topic. Thank you for watching.